Hey, welcome back to the show. On today's episode, we have a very, very special guest, Amber Kerby. Amber, how are you, ma'am?
Good. Thank you for having me.
Absolutely. I'm really excited for this conversation and to learn more about what you do. With that being
Yeah.
said, for those of us that don't know anything about you, can you please share a little bit about yourself and how you help people?
Yeah. Well, I'm Amber Kerby. I live in Des Moines, Iowa, or the surrounding area, really. I'm a licensed marriage and family therapist, and I primarily specialize in ketamine-assisted psychotherapy and also IFS. I'm IFS level 2 trained, so it's my favorite modality.
Wow. How did you get into the ketamine assisted therapy, Amber?
Yeah. Years ago, I began discovering psychedelic assisted therapy, really digging into the research there. And that really prompted me to pursue some training. The research was really undeniable about how it positively impacted mental health. So, as a mental health care provider, I thought, well, shoot, I can't unsee that. How do I offer more of this? So, I did a year-long training through the Integrative Psychiatry Institute in Boulder, and part of that training covered ketamine-assisted psychotherapy. It's the legal modality that I have access to, especially here in the Midwest. And so it was a perfect opening to begin linking my mental health care background with my interest in altered states and the healing capacity for that.
Wow, so many threads to pull on. That all just sounds so fascinating. I like to shift gears for a second and then come back to ketamine assisted therapy, and that is, who do you work with the most? Like, who's your demographic?
Yeah, right now my primary demographics probably between 45 to 60. Most people who are coming, especially for ketamine-assisted psychotherapy, are people who have tried a number of different approaches, plenty of medicines, plenty of therapies, and continue to just battle the symptoms. So CAP almost feels like a last-ditch effort to feel better. So I'm seeing just your average folks walking in to the office, really curious about how this could potentially help them.
Yeah, wow. Amber, is there a particular, I don't want to say, diagnosis, but a particular concern that really kind of fits ketamine assisted therapy, or could
Yeah.
really anybody with depression or anxiety kind of seek out your services? What does that look like?
Yeah. Well, in research right now, treatment-resistant depression is one of the primary indications for ketamine treatment, and that could be within a clinic or within a therapist's office. But we're also seeing more research on anxiety, OCD, PTSD, eating disorders, and even substance use. So it really depends on the format of ketamine you're going to use and the setting, whether you're going in a clinic or in a therapist's office. And that really dictates who feels comfortable working with what indication and how they're going to be offering the treatment.
Got it. So it really comes down to the setting and the therapist to kind of
Yes.
determine what is going to be treated.
Yes.
Got it. Amber, earlier you mentioned the research. What did you see about the research that made you kind of realize, like, this is what I'm going to pursue?
Yeah. It was actually, I remember the moment pretty clearly. I was looking into MDMA and the research that was coming out of that with PTSD. Now, as you know, and most of the audience knows, PTSD is a really tricky symptomology to hold carefully in a therapist's office. There's not a quick cure to it. There's not a quick medicinal intervention that's going to really support our clients through that experience. And so that research was basically showing us that about 70% of those in the study, after fulfilling the protocol, which is about 3 medicine sessions with 3 or 4 integration sessions in between a medicine session, 70% were no longer meeting the criteria for PTSD. And that completely blew my mind that we had a potential modality to treat something that is treatment resistant. So it really sent me down all the side streets of like, well, what are we doing with psilocybin? What else is out there? And then, of course, ketamine. And the research on ketamine was phenomenal, especially for the antidepressant application for it, where when people are on SSRIs, typically they've got to wait a couple weeks up to a couple months to really feel how that medicine is going to interact with their body. But with ketamine, a lot of people are finding relief within hours or days. And that also to me was mind blowing when we've got such a heavy need for a shift away from those symptoms so people can really do the work they want to do around it, to find that relief the same day that they get treatment so they can begin integrating what's going on with those sessions is just completely not what we're seeing in our typical therapy offices with the psychopharm that we're generally using.
Wow. Yeah. And, I've heard of ketamine-assisted therapy in the, a few times. I still kind of personally consider it like a little bit in the fringes, or just like maybe not as well known is probably a better way to put it. But what are some of the misunderstandings or myths about ketamine-assisted therapy?
Yeah. Well, I think I want to back up just a little bit to talk about the difference between ketamine therapy and ketamine-assisted therapy, or ketamine-assisted psychotherapy is what I like to call it, CAP versus KT, ketamine therapy, because we've got kind of a couple different ways that people are engaging with the modality. If they're utilizing ketamine therapy, this is typically happening within more of a clinical context. This is a medical procedure now where they're leaning on the medicine for symptom reduction. So within clinical use, we're seeing a lot of IV, IM, which is intramuscular, or even the nasal spray Spravato, which is actually FDA approved for treatment-resistant depression. So we're seeing that format become accessible for people. And now we're seeing this movement more towards ketamine-assisted psychotherapy, where we're utilizing low doses of ketamine within the therapy office to really guide and hold the experience, to prepare the client for what this is, to be with them in real time with what's happening, and also to sit with them in integration so they can begin deepening and extending the benefits of the treatment.
Got it. Okay. So thank you for that. So there's ketamine therapy and then ketamine-assisted therapy.
Yes.
And ketamine-assisted therapy is what you do and what other therapists who are trained in this particular therapy provide clients.
Yes.
Got it.
So
Okay.
as a therapist, you may be hearing about your clients, in ketamine therapy, going to a clinic, different dosing, different setup, and can still be quite impactful. So I think there's value to both. Mm-hmm. And it's really important that I think, especially as mental health care providers, we understand the difference of what's happening between the two settings. So that's maybe a common misunderstanding that, especially for a lot of therapists, they just assume if their client says, yeah, I'm seeking ketamine therapy, they're going straight to the clinic. And what is that really like? And how do I help my client then integrate that, which is, probably a whole other trail that we can wander down later in our chat. But I think, another misunderstanding is a concern around, is this legal? That's one of the top questions that I get. Oh, you're working with ketamine, is that legal? Yes. It is legal. Ketamine has been approved for human use since the 1970s. So it is not a mystery medicine. This is something that has been used for human indications for quite a while. It is a controlled substance and it is legal. It's legal for us as therapists to be able to provide our services to clients while they're engaged with this medicine, because it's being overseen and managed by a licensed provider. So they're the ones that are handling the medical aspect, and we are the ones handling the therapeutic aspect.
Got it. Okay, that makes a lot of sense. And I'm really glad that you kind of provided some clarity between ketamine therapy and ketamine-assisted therapy, because that I did not know. So thank you for that education, Amber. I appreciate it. I like to kind of hang out on this topic of the provider. So if somebody comes in and they seek out ketamine-assisted therapy, so how does, do they consult with a provider first during the sessions with you, or how does that kind of process play itself out?
Yeah, in my process, I typically ask people to come in my office first. So I can even go through some of our basic suitability, some mental health, some of the major medical suitability that we do need to ask about, because primarily I want to ensure that I'm a good fit for the client and the client is a good fit for me before we continue the process of ensuring medical suitability, going into preparation and into dosing. So I do have them come and sit with me first. We do an intake. intake, some introduction to the screening, and really get a feel for what are we going to use this for? Does this feel appropriate? Does this feel safe and useful for both of us to be in this space together? And if that feels like a yes, we then move the client into medical suitability and into preparation sessions so that I can build a relationship with someone if I don't have a relationship with them already, and do what we can do to the best of our ability to prepare them for an altered state.
Wow. And so when do they interact with the provider? Like, I'm just kind of curious, like, is there ever a point where they're like talking with them and then the provider talks to you? How does that work?
Yeah, ideally. I've got a couple different prescribing professionals who collaborate with me, just depending on the client situation and the client needs. So it's usually a meeting that occurs somewhere around the first few weeks before they actually engage with the ketamine. A lot of that depends on the prescriber schedule and the client schedule. But typically within 2 weeks of us saying, yes, let's go ahead and do this, they're able to get in with a prescriber, ensure the medical suitability, and we may be knee deep in preparation by then as well, which is also lovely. So I love to be able to have a conversation with the prescriber. Usually when I'm sending referrals, I'm giving them as much background information as I can per the client, releasing that information to them just so we're all on the same page and really providing care for this client.
Yeah, yeah. And I definitely want to touch on the preparation phase of the treatment because that's something that sounds really important, just to make sure that they're ready and prepared. But before I get there, Amber, I'd like to ask about the actual handling of the ketamine itself. Like, do they send it directly to your office? Do they give it to the client and then they bring it in? How does that work out?
Yes, yeah. So it's a controlled substance. We have to be really respectful about the lines there and the liability that the prescriber is even taking in order to support this type of process. So I'm not a medical professional. I do not receive, store, or distribute controlled substances. The prescription is written specifically for ketamine-assisted psychotherapy, and it is sent directly to the client. I've got a couple pharmacies in my area that will either mail it out or clients can go in as well and pick it up, just depending on where they're located in the state and what their comfort level is. And then they're bringing it in office with them. We go through some just basic safety protocol around how to store the medicine, ensuring that it's, temperature controlled, that it's safe from, any little hands that might be curious about it, because it's a controlled substance. We want to ensure that we're wrapping a lot of safety and care with that. But that's, a lane that as a provider for mental health, that's not a lane that I need to be into. I don't handle people's SSRIs. I don't handle their medications in general. They don't get sent to my office. They don't come in my office in order to take their daily medication. So that is something that is happening between the client and the prescriber.
Got it. That makes sense. So they go and they pick up their medication, however that happens, and then they arrive to session ready to go with the ketamine. Got it. That makes a lot of sense. Thank you. For some reason, I had this idea that the providers would mail it because it was a controlled substance. They would send it to you, and then you would store it there, and then they would show it. Another myth.
Yeah. And that sounds like a nightmare for me, because then I'd have to have the safe in the floor and whatever else the DEA rolls out in order to keep, these kinds of medicines safe. And that has, nothing to do really with what I do.
Yeah, for sure. Absolutely. Amber, I'd like to go back to the preparation phase. What does that preparation phase with the client look like? How long does it typically take?
Yeah. The length of time really depends on if I've got an established relationship with this client, especially if they've got additional things going on in their life that we need to kind of slow everything down and address before we go into dosing sessions. But my bare minimum is 2 preparation sessions. And essentially what we're doing during those is really talking about the client's mindset. What are their intentions? What are their expectations, hopes, fears? Really digging into that aspect. And then also the physical setting. I want them to come in my office at at least once. I do a lot with teletherapy, so I can be flexible, but they do need to get their body in here at least once before their dosing session so they can get a feel for the physical space. They can get a feel for the sofa, they can get a feel for where the restrooms are, and just kind of how to navigate getting in and out of the building. I find that reduces a lot of uncertainty and anxiety for clients when they've got some familiarity with this space. We also go through what I call a dry run of what the ketamine session is going to be like, coaching around self-administration and timing, some things about what they can expect it to feel like in their body, how to ask for grounding and support if things are starting to feel a little bit uncertain, and kind of going through the flow of how we interact and how I follow their lead during those sessions to kind of tune into how much real-time processing they're interested in and how much self-reflective time they're interested in those sessions.
Got it. That makes sense. Amber, the traditional kind of length of therapy is it's anywhere between 45 to an hour, just depending on the clinician and other factors. How long are sessions with you if somebody's doing the ketamine-assisted therapy?
Yeah, the actual dosing sessions, for me, I hold 3 hours for it because I do tend to spend a little bit more time before they self-administer the medicine, getting grounded, talking about integration, talking about how the week has gone. So I'm not too caught off guard with any content that might come up in sessions. The actual time with the medicine is about 45 minutes to an hour. And then I also want to spend some really good time with them post medicine experience so that we can begin to work on the initial integration. That gives the client space to talk more about the content of what happened, to revisit what their intention is, and begin linking some of those aspects so that they have an idea of what they want to do moving forward this week. Is there something that they need to do? Is there something that they need to think about a little bit more? How do they really take what's happening in session and begin infusing it into real life?
Got it. Okay, so just to make sure I understand correctly, so it's a 3-hour session with like a warm up, and just kind of getting to know the client as far as like what happened recently, and then they self-administer, and then that typically the effects of that typically last about an hour, and then after that, the effects kind of fade away a little bit. Then you guys integrate. Got it. Okay, got it. That makes a lot of sense. Amber, super interesting. I'm really fascinated by this whole by ketamine-assisted therapy, and I like to ask about the journey, the client's journey, right? They show up, they do a couple preparatory sessions, at least a couple weeks, spread over a couple weeks, and then they come see you. They have their prescription in hand. They do the first session. How many of those sessions do you typically do with a client? For them to kind of start seeing progress? What does that look like?
Yeah. So my typical protocol is to have about 6 to 8 dosing sessions. The doses that we're using are low. I mean, the goal in my office is what's called psycholytic therapy. It's a dose that's going to create an altered state, but not a state that leaves people so disconnected from me, from their body, from their surroundings, that they can't interact. So the number of sessions that we're beginning to see the most value in is typically by the 3rd session, because the low dose, it's a little bit slower, a little bit more cumulative. So typically within my office by session 3, people are saying, oh, I'm really feeling more of the effects here. I understand what you mean by here's the workable space in the session, and here's how it kind of flows into my daily life. So that's why I really like the 6 to 8, because they're hitting their stride by 3. And I want to give them a couple more sessions to really dig in now that they understand more about what the terrain is.
Yeah, that makes a lot of sense. And are you doing like every week, or what's the cadence look like for a client?
Yeah, for me, it's every week. They come in once a week. Every once in a while, I'll have clients do every other week when they're taking some really good deep time to do some integration. But typically, for my calendar's sake, every week is a little bit easier.
Yeah, that makes a lot of sense. Amber, in session, some clinicians are very kind of like solutions focused, right? They're like getting to the point as quickly as possible. Others are a little bit more laid back. They kind of let the client lead.
Yeah.
How would you describe your style in your sessions?
Yeah. It's definitely a mix. When we're working with altered states, it's not a linear process. So when we're trying to hold too much of a framework, too much of a structure, it can really get lost with the client if they're not on the same wavelength as we are. So depending on the dose and depending on the client, for the most part, a lot of my work is holding a container, holding a framework, holding their intention with them, but really following the lead of the client. More of the structured work is happening in preparation and in integration. Now, there are times that I've got clients on lower doses with the intention to do ketamine-assisted IFS work. They really want to go in and do that parts work intentionally and are asking for more of that structure and more of that guidance. So sessions like that feel more directive, even though IFS isn't particularly a directive approach in my world. It's definitely more interactive. But there are plenty of sessions where we're flowing in between interactive and also very quiet self-reflective time so that the client can really tune into what's happening in their own system, can notice what's going on somatically, what's happening cognitively, what's happening emotionally, and be with that versus having to interact the entire time with a therapist.
Yeah, wow, that makes a lot of sense. And Amber, when a client is when they self-administer the ketamine and they start kind of experiencing the effects of it, what are some things that they might experience? Like, can you describe some of like the physical experiences?
Yeah, I think for the most part, the words that people like to use are they're feeling a little bit more floaty. Things feel a little bit more spacious. There are points of the session where it feels like maybe there's some rapid thoughts happening. And also there are times in the session where it feels like everything has slowed down and they're really in more of that meditative state where there aren't a lot of thoughts happening, which, as you can imagine, feels incredible for so many of us who are constantly thinking. At its root, ketamine is a dissociative anesthetic. So what it's really designed to do is to just give us a little bit more space. So on those lower doses, it's not a dissociative where people are all of a sudden checked out, they've left the room, they've completely left their body. It's a matter of being able to maybe lean back and just give things a bit more space, see more of what's happening versus turning our back and walking away from what's happening.
Yeah, and as you say that, to me, it sounds like some of those walls kind of come down. Is that kind of a fair?
Absolutely. Yes, defenses begin to soften. The entrenched patterns that we're into begin to get a little bit wider, like, oh, well, perhaps instead of always this way, it could be this and this. The idea of both and constantly comes up in this space instead of
Yeah.
either or, which is so freeing for so many people to begin to realize, like, wow, I was really stuck in this black and white.
Mm.
And now there's more flexibility. I have more options, which means that I can change, which means that the situation can change when I've been spending how many years thinking that it can't.
Yeah, wow, that's so fascinating. Is there maybe an anecdote you can share about your work, like maybe like a common theme that kind of surfaces, or something that kind of describes this black and white thinking that a client may be experiencing or has experienced?
Yeah, I think, and maybe it's because I live in the Midwest and we have a lot of construction all the time, that what really begins to boil down for me is this idea that, like, we begin traveling the same roads all the time. We do it behaviorally, we'll do it mentally. We've got our patterns, we've got our ideas, and we've got our perceptions. But when you keep traveling the same road again and again, it begins to break down. You now have potholes. There's a lot of traffic on it. Things can really get backed up because there's so much happening on that. So what ketamine's able to do is come in and say, hey, I know that this is an option for us. Great. There's also 10,000 other side streets here that we can begin exploring. And so that neuroplasticity comes in order to help us shift from this main road and let's take this side street and see what happens. And the more often we take these other side streets, it alleviates some of that traffic on the main road. We can repair some of it. We can decide, yeah, I do want to take that road during these times. And also I have all these other options of how to get to where I want to be.
Wow. Yeah, that's incredible. Amber, after a clinician, or excuse me, the client experiences their first session with you, and you do the integration, what is, well, let me ask you this first. What does integration look like during the first session? And then what is the client's feedback after kind of that integration phase is done, just about the whole experience?
Right. So integration in the first session is more about holding some space to hear the content, to allow the client to begin processing. This is what happened. Maybe if they had, an insight, if they had a memory come up, if they really noticed something happening in their body, it's a way for them to begin just reporting so that we can begin to make sense of things. So typically, wow, as people are coming out of that first, second, third session even, I think the first maybe one or two are a little bit more confusing, maybe a little bit harder for people to shift from logically understanding to ketamine sessions are really more of an experience. And so we're going to do our best to put some sort of language on it, but sometimes that doesn't even do its justice to actually describe it. It's like if you go to the Grand Canyon and have that experience, it is incredible. But then to try to bring it back to someone who's never been there and to just use some of the words that we have to describe it or the pictures that we tried really hard, like, oh, I could capture it. It's not the same as actually being there. So we want to give, people enough time and space to be able to kind of figure out what that means for them, to give themselves permission of like, I'm going to use this word, but I know that I feel it differently in my body, which is a-okay, because we can really begin to link those things. So when they're talking about like, yeah, that color blue came up. I mean, obviously I don't know exactly the shade of blue that they're talking about, but I see how it impacts their body. And we can really anchor into more of what that meant for them and pull that into future sessions and future integration sessions.
Wow.
So,
yeah. Go ahead, Amber.
Yeah,
Sorry.
no, I think, just kind of wrap it up. It's like, as people are getting more skilled and kind of landing the experience, being able to label what they can label and also honor that there are things that can't be labeled and bring that into the whole intention of why we're doing what we're doing. What are we actually looking for and how are these experiences going to serve us? And that's more of that deeper integration work where we can really help people get more embodied with who they are, what their values are, what changes need to happen, how to show up differently in life. That's going to happen a little bit later on in our integration work.
Got it. And as you were saying that, Amber, going back to that analogy we use about the one-way road full of potholes and stuff's going on it. And it just reminded me of this time when I was driving and then there was the freeway was cut off, or there was an accident, and then everybody had to exit. And it was just a fiasco. Like everybody had to do U-turns and we were like trying to navigate our way out of it. And as you were talking about that first, maybe first experience or even the first few experiences where it's like just hard to kind of, figure out, that's the image that came to mind, is that it's just kind of like everything's rerouting. We're taking these other roads that are now open to us. But eventually it starts flowing, and we're able to make progress. And so, I don't know why that came up for me. Anyway,
it's perfect though. That I'm going to steal that. It's the perfect parallel of what's going on. Where initially, like that change, taking that side street, you're like, I don't know where we're going. This is really uncomfortable. This is unfamiliar. Am I really going to get to where I need to be? But I'm going to add this additional component, like even though there's the surprise accident, like everything's blocked up, the ketamine can really open up neuroplasticity, which is like your GPS system, basically saying like rerouting, here's where we're going to go. And there is kind of a blind trust that's happening when we're detoured, like, oh, I hope there's some signs up. I hope my GPS can keep up and actually get me where I need to go. And that does make the change easier versus when we're trying to do it like, okay, well, I can't take this road. I'm going to have to go over here, I guess, but I don't have GPS. There's no signs up. Like, remember back in the day when we had paper maps?
MapQuest.
Right? Yes. And we're like desperately trying to read it. That change is a lot more difficult than just like, well, okay, I guess we're taking this road and it says keep going for a mile and then turn left. That seems like a strange direction, but okay, I'm going to trust that I'm headed in the right direction eventually.
Yeah. And, you use the word trust. And I think that's, massive. And I wonder, as you're doing the preparation work, is that kind of what is happening? Is you're building up the client's trust in the process?
Yes, in the process and in their own wisdom and ability to navigate something like this. They're really in a vulnerable space with this medicine where things are shifting. They might be feeling uncomfortable. And even though I'm physically there with them, I'm not 100% in the experience with them. So I really want clients to feel a little bit more grounded in their own ability and capacity to be able to be in those states, to flow with whatever's coming up, to trust that what's coming up, even if it's unexpected, is actually something that's important and that can be useful with this broader direction of where they want to go. Because if we're going to fight it and resist it and try to control it, that's not going to go well in any altered state. That's really not the purpose of giving ourselves that space if we're going to keep clawing back to the same pattern and trying to force it into the same box. It's not what this is for.
Yeah, and that reminds me of a quote by Dr. Yalom. He said, "Everything is grist for the mill," and it just this exactly the conversation or your answer just reminded me of that everything is data that we can use to process in therapy, and that's really awesome, Amber. I like to talk about the processing itself or the integration component of it. I know you kind of touched on this earlier, but maybe you can kind of elaborate on what does integration look like when somebody doesn't know how to explain certain things, and all they have is the trust, and they're like, well, I don't know. I went to the Grand Canyon and I don't really know, for example, like I went to the Grand, like what's going on here? How do you help them integrate that? And then especially as they move forward and they get more clarity about what's going on.
Hold a lot of curiosity. It's very difficult, I think, for a lot of therapists to not add in their 2 cents, to talk about their theories, to add in like, I observed this, I've experienced that, but to really give the client a lot of space to make their own meaning. That is going to be the most important aspect of what long-term integration looks like, because it's kind of like the idea of seeking advice. I'll talk to 10 friends about a problem, but I'm only going to take the advice that actually resonates with me, that I'm like, oh yeah, no, I knew that. I just needed someone to validate that. So we can tell our clients things, but that's going to land flat if it's not something that is already being generated within their own system, their own aha, their own awareness. So a lot of questions, a lot of curiosity, I think too, utilizing some other interventions that aren't just language and cognitive based. So somatic, artistic, like what other elements can we pull into integration that speaks to this deeper level of experience that may not have a word? I've been gifted with a couple art pieces that clients have done, which are just lovely visual reminders of being able to flow with an artistic process, put down colors that resonate with them, put down images that resonate with them. And it's such a nice way to make sense of things without it always having to be a cognitive language model base that doesn't do an altered state justice at times.
Wow, yeah, that's so fascinating because I certainly agree with that, and that um, the meaning could be found not by explaining or with words, but really by doing something else. Whether it's some kind of art, or moving the body, and that's so fascinating because even just personally, like I just process when I'm running, and then like I'll run or work out, and then like after whatever amount of time. I don't even know what I thought about, but I just feel better. And then I
Yes,
also get clarity on the way forward, if that makes any
yes,
sense. And it's so strange.
absolutely.
Yeah.
Hmm.
Yeah.
Yeah,
That's
but not at the same time. Like that's kind of how we as humans are
mm,
designed
mhm.
to be able to work through things, to be able to allow energy behind emotions and memories and, somatic based interventions that allow us to kind of complete
Yeah.
what's going on there really does allow that bigger reset for the system of like, okay, cool. All right. So that did what it needed to do. This experience is kind of moving itself through. And true integration is not just holding on to the mountaintop experiences and always chasing that.
Mhm.
It's utilizing that as a catalyst for this greater change.
Yeah. Yeah, and I love that you said complete the experience. That I think that it makes perfect sense to me is that we're just using other interventions to complete, this progress or this change that's occurring. Wonderful, Amber. This is so good. I like to go back, if you don't mind, to the research.
Yeah.
What as you were starting the research, you mentioned that you were kind of digging in, but what motivated you to do that in the first place? Like, how did that come up?
Yeah. It really started with a close friend of mine who was a poster child for treatment resistant depression, had tried all of the interventions and just continued to struggle. And so they came to me one day and they said, I know you're a therapist. I don't know if you know anything about psychedelics and mental health. And I sure didn't at that time. And I definitely had some concerns. I had some hesitations. And honestly, I know now that a lot of that was based on just stigma, misunderstanding, and not knowing what was in the research. So, I wanted the best for this person. So I thought, okay, well, they're convinced that this is going to help them. Let's see what the research says. And I'll call myself out, but I'm pretty sure I was doing that in order to find research that would convince them to not do it because it sounded like such an extreme idea that I'm like,
Mhm,
wow, you're going to go do what? I don't
mhm,
know that this is good. Like, what is this doing to your body? What is this doing to your
mhm.
brain? I'm a 90s kid, dare, drugs are bad. Like, none of
Yep.
that seemed like it was a good
Mhm.
idea. But of course, I began running into all the research that proved me wrong. And I thought, oh, holy smokes. So not only did I get to see what was in the actual literature, but I got to see how this person interacted with these medicines, truly engaged in the integration work, and has completely turned their life around. And it's been the most magical thing to be a part of,
Yeah.
to witness, and to really see more of who this person is come out in a way that it's authentic, even though they still have down days. Depression is no longer like a huge cloud that's over their
Mhm.
head. They know that they have space for it, they know how to navigate it, and they're really building a life that is fulfilling and an honor to be a part of.
Wow, Amber, what was it like when you treated your first client using ketamine-assisted therapy?
It was, oh boy, yeah, I still remember it. It was really exciting, and also I was incredibly nervous. My first prescriber who worked with me, she actually wanted to be in session, so I kind of felt like I was being watched and evaluated on one side, but also so excited to be with this client in this altered state. Um, and it was actually through that experience that I began shifting my own practice to more of a psycholytic type of therapy versus psychedelic. My training was psychedelic, where people are engaged in a bigger altered state. They're not always as connected to the provider. There's a lot of quiet meditation, holding space, holding some anchors for people, but not necessarily the same give and take that we're seeing in psycholytic therapy. So I do remember about halfway through the session being very surprised that my client was continuing to talk through the whole session. And I was like, oh, I'm not sure that my training really covered all of this. How do I flow in as a therapist and still honor the fact that she's in an altered state? And so it really sent me down additional work as far as, all right, the doses I'm using is a little bit different than what I'm, trained as far as psychedelic therapy. How do I really hone in on what's happening within the psycholytic therapy aspect of it? So it was an incredible gift. So beautiful to be a part of the sessions with this first client. So incredibly nerve-wracking. She was very gracious as I ironed out a couple details that I didn't even know I needed to iron out. And also, I always give her credit for being the person that really set me down the path of, oh, this could be really therapeutic with a professional who's trained, who's clinically aware of what's going on, and can also navigate altered states.
Wow. Yeah, that's awesome. And what was the prescribing providers' feedback to you? Because were they present after all? Did they?
Yeah. They stayed during the entire thing. And so, her feedback to me was really good. I assume that it's still really good. She was very gracious and just, really reflecting back how different this work is, because she's seen the regular talk therapy, but to be able to see this dose of ketamine in real time with the client in a therapeutic context, I think it gave her a lot more confidence too, to be able to prescribe and know that it's being held in a really safe container, in a really responsible container, and that clients are really navigating that shift well.
Yeah, that's so good. Amber, I like to ask about the clients themselves.
Mhm.
If they're they're listening to this episode, they're liking your style, they're liking everything you're saying, but maybe they're just a little unsure about reaching out, maybe because they've never done therapy before, maybe this style of therapy is different and unknown to them. What would you want them to hear?
Oh boy, follow your curiosity. If it's coming up for you in a way that is bringing up gosh, I wonder if this could be for me. I think that that's wonderful. And so the only way to know that if it's for you is to begin asking more questions. So if I can be of service to anyone who's really got more questions as a professional or as a client, very open to having conversations, and also beginning to do some research in the area. What is accessible to me? Are there clinics? Are there therapists? What does that actually look like where I'm at? And how do I just begin? Well, make a call, send an email, take that first step to just begin asking the questions that you've got.
Yeah, so good. Amber, I like to shift gears a little bit and ask you about just your personal experience in the field, not necessarily with clients, but just kind of navigating, I don't know what the appropriate word is here, like challenges or the stigma within the field, because there are, a lot of clinicians who are more senior and in the field that still are like, hey, like anything right? Drugs bad, right? Like the stuff that we learned back in the day. What has that been like? And also, why do you think that there is so many clinicians that are not practicing, given the amount of research that's out there to support this ketamine-assisted therapy?
Yeah. Ooh, yeah. Starting out, especially in Iowa. So if anybody is familiar with Midwest, it's Midwest nice. There definitely was a part of me that was a little worried about pushback and about opinions that were very different than mine. But what I found was actually people would rather ignore me than push back on me, which was kind of fascinating. Actually, I don't know why that was a surprise. It actually makes sense within Iowa culture. But as I began navigating it and really kind of tuning into who's interested and who's not interested, who's open to this, who wants to have discussions versus who doesn't, I began to get the feel that I think it's unfortunate within our community of professionals that we begin to bump up against competition that undermines each other versus competition that can help really feed accountability and feed the movement of treatments in mental health. So if things are looking a little too novel, a little bit too scary, instead of remaining open and curious, like, let's see what happens, let's see what the research says, so many people will double down on their typical, like, this isn't what we should do, this isn't how this should happen, and then they begin trying to poke holes in new modalities instead of really holding that I wonder mind frame.
Yeah, and it's a little disheartening, just because, as a clinician, I feel like that's one of the mainstays of being a therapist, right? Just being curious, being open,
Yes.
holding space, right? Something that we kind of say a lot in the field, and so it's just, yeah, it's interesting how that works out. For those clinicians that maybe don't know a whole lot about ketamine-assisted therapy, do you provide maybe some courses or some resources, some education for them to kind of get into this?
Yes, yeah. I think about it was probably a year into it that it became so apparent to me that I need to get more of the word out about what's happening here, what's not happening here. I wanted, more of my professional community to be able to make informed decisions about how to talk to their clients about ketamine, and also to begin equipping therapists to hold some integration space for clients who are maybe going into the clinics and coming back in their office and reporting like really significant altered state experiences, but not very many clinicians knew what to do with that, other than like smile and nod and kind of make a note and see if I need to monitor that, versus understanding that like that's a gift and there's a lot of wisdom in what my client is reporting, and I can integrate that into the work that we're doing. So about a year into offering services, I began offering workshops for clinicians to come in and learn about ketamine, also with an experiential component for clinicians who were interested and appropriate for a medicine experience to actually get a feel for a low dose ketamine, what that is actually like in the body, in the system, how does preparation work, and how does integration work. So I do find that the clinicians who've gone through something like that, they feel more confident in speaking to clients about ketamine-assisted therapy and ketamine therapy, and also how to integrate that because they have their own non-ordinary experience to pull from. So when their clients like, oh, this is going to sound crazy, but the clinicians who've gone through trainings like this are like, it's not crazy. Like, bring it on. There's gold there. I can't wait to pull that in. And that's so validating for clients to be able to know that it's a safe place to bring that. So I began doing that. I did that for a couple years. And then last year, I actually rolled out a comprehensive certification program because I would do these workshops and then clinicians are like, well, how do I do what you're doing? And at that time, I'm like, well, here's a couple options. A lot of them are year long, and they're going to mix in some different medicines. So if you're interested in that, like long term, go do that. But very few were actually doing what I was doing. So I had this crazy idea that I was like, well, why not start rolling out a program where clinicians can come and really dig into what's happening with ketamine-assisted psychotherapy, with psycholytic dosing. So it's a 10-week program, and we've got an experiential weekend that I actually just did this last weekend. So kind of coming off a huge energy boost from that, to watch clinicians come together and really experience the medicine, experience what it's like to be a therapist in that container. And then they also have the opportunity to witness a couple times. So they're really getting a lot of experience in one weekend about all the formats and how this can go. And so just to see, their confidence after a weekend like that is so incredibly heartwarming and encouraging for me to see, especially in my area, to see the number of qualified therapists offer this. Because in my book, like, every therapist could offer this to every one of their clients,
Mhm.
and we could change the state. We could change
Wow.
the nation, and I would be okay with that. Like, I work myself out of a job if that means that like people are cared for and really finding healing. I
Mhm.
am good to go with that. So it's been a really cool way to continue giving back and equipping, and also building up like a peer network for
Mhm.
myself. When I first started, my peers were everywhere else in the nation, and no one really understood Iowa. So it was very frustrating when my peers from Colorado were like, yeah, it's like this here. And I'm like, it took me 8 months to find a prescriber. Like, it
Wow.
was really difficult. I was the first
Mhm.
one in the state to do this, and I didn't know who to go to. So I was
Yeah.
making all kinds of calls and trying to figure out who would be open enough to go on this journey with me. And now we've got, I would say there's at least 7 prescribers that I can think of off the top of my head just in my area. And we have, after this cohort, I've got about 30 people within Iowa, Nebraska, and Illinois who are now trained to do ketamine-assisted psychotherapy utilizing psycholytic doses.
Wow, Amber, sign me up. I'm trying to go to that
Yeah.
retreat. That'd be so cool.
Yes.
And and I think it's so true, right? It's like uh, for clinicians, like experiencing it. I mean, you just have to experience. Like, how are you going to go and treat people if you haven't, experienced? And I get it.
Yeah.
Like, it's like saying a doctor needs to have cancer if he's just going to deal with cancer
Yeah.
patients. That's not what I'm saying. I'm just saying it could boost the effectiveness of the clinician when they understand kind of the feelings and the
Yes.
sensations and the whole experience. They don't need to go through a whole course of therapy with it, but just understanding, like, I
Yeah.
know what's going to come up. I've experienced it. So yeah, I
Mhm.
definitely see where they can be more effective by
Yeah.
having that experiential event.
Yes.
Super cool. And wow, yeah, I did not know that you were the first one in the state. That is so
Yeah.
awesome. Yeah, you're a
Yeah.
true pioneer.
Right. It was
Yeah.
wild. I was like, oh,
Mhm.
no one else is doing this.
Yeah.
Oh, it's only in clinics. And then, the clinics weren't necessarily set up or open to the idea of having a therapist sit in with the dosing sessions. I get
Mhm.
that. They're doing what they're doing over there. And so I was like, well, how do I do it here then?
Yeah.
Because I can.
Yeah. Yeah.
So let's see how this works.
Super
Yeah.
cool. Yeah. Amber, I'd like to ask about the program itself. So if clinicians want to participate in that, do they need to be in Iowa, or could it be anybody from all around the
Nope.
country?
It's nationwide. Yeah, yeah. I'm open to nationwide. The classes are all virtual, so we can log in from anywhere, which is wonderful. The experiential weekend is in person, and because I'm based in Iowa, everyone's got to come to me. But I do get it set up so that we're in a nice place that's got the accommodations for the therapeutic work, and also for people to be able to stay overnight. Um, all prepared meals. You just got to get here to me, and then I'm going to take care of you during the entire weekend. So I'm really excited to see how this is just continuing to kind of ripple out. I'd love to see more providers from other states. I'm continuing to grow my own network for prescribers in other states, because that's always the biggest challenge. Is like, okay, I've got a therapist, in Nebraska right now who's like, who are the prescribers? I don't know. Let's find out.
Yeah.
So I'm really enjoying being able to reach out to additional states to find out what the culture is there, who's already doing some work, who's going to be able to support additional practitioners. How do we begin to really
Yeah.
network and build the supportive communities that are necessary in this kind of work?
Yeah, and it sounds like ketamine-assisted therapy really is a great way, or a great tool, so to speak, to add to a therapist's toolbox. Because
Yes.
it sounds like, even though this is a whole training program and there's a whole protocol and there's a process to it, a clinician doesn't have to use ketamine-assisted therapy, right? Like, you could still do
Right.
traditional talk therapy. Is that?
Yes.
Yeah.
Yeah, yeah. I mean, in my own practice, I do no more than 3 ketamine sessions a week, and the rest of my week is traditional talk therapy. So it could be clients who are using ketamine and clients who are not. So it's not like it's a training that's meant to flip your entire practice to ketamine-assisted therapy. For most places, that's not sustainable, and probably not sustainable for the clinician, just given the intensity and the length of that work. So it really is meant to be an additional intervention that we can offer our clients or offer our community.
Yeah, super cool. Amber, what is on the horizon for your practice? Are you thinking about bringing on some more staff members? Maybe expanding on your courses? What does that look like?
Yes, yeah. I'm going to be expanding a little bit on the courses. I want to do a few more webinars and things like that. I want to be able to just get some education and some information out. I will be offering a fall cohort for the Mastering Ketamine-Assisted Therapy certification program. So that will begin rolling out. And then my new little passion project is to expand the work that I'm doing with ketamine and couples. So in May, in the Des Moines area, I'm actually having a one-day workshop for couples to come in and engage with the medicine. It's called Reconnect, because the intention of the day is to really equip couples to communicate in a way that's going to be just a little bit more reconnective for them. So I'm really excited to do some additional work, especially with couples. I'm trained marriage and family. I do enjoy working with couples, and at the same time, that can be some of the most frustrating work because we continue to have the same conversations over and over again. The content may change, but the process gets so sticky. So if we can utilize something like ketamine to help people get unstuck from the sticky processing, that's a win in my book.
That is amazing because I'm also marriage and family therapist. And when you said couples work, I'm like, I'm like, yeah, that's so cool.
Yes.
And that reminds me of a question that I wanted to ask earlier, but I didn't get to. And that is, if there's a client that's going to see you at your practice and they're going to do the ketamine assisted therapy, can they bring their partner or just to kind of like get some more information and resources, not necessarily be the client, but just kind of be present to learn more about it?
Yes, absolutely. Yeah, I've had a number of people bring a supportive person in their life in a couple of the sessions, especially with preparation. I have a couple documents that I usually give people, even if I don't get to see their supportive others, in order to help equip whoever's supporting someone going through CAP to really understand more about what their loved one's about to do and how to be really gentle, especially if they're going to be the transportation afterwards. Like, don't just fire away 20 Q&As. That's not going to go well. Really allow your person to slow down and to process at their own speed, to tell you what they want to tell you and just kind of flow with it. So it is helpful if we've got anyone who's got, concerns about how this is going to impact their loved one or how it's going to impact their relationship. I love having them in this. I've also invited in significant others with clients in their deeper integration. So if really intense things have come up during their session that they know, like, oh, I really need to bring this to my partner and I don't know how to do all this. We take some good time after these dosing sessions to let things settle in with the client. And then if couples work is the next intervention that we're going to do, wonderful. We have space for couples to come in and begin processing more about what this person has experienced and how this can flow into the relationship and supporting the changes that can happen from there.
Super cool. Wow. Yeah, that is great. Amber, going back to the what's on the horizon, are you looking to hire anybody? What's going on with this guy?
I don't know. That feels like a lot. At this point, I actually, my husband is finishing up his master's degree. And so we're going to be doing some work alongside each other, but I'm not going to hire him. I think I would be a terrible boss for him and he'd be a terrible employee for me. So it's going to be more like a partnership. But at this point, I'm not ready to add additional clinicians to the practice and having to manage the admin and things of that nature. I do offer supervision though, which I've really been liking. So especially for people who are working towards their license. And I've had a couple of these folks finish the certification program. So they're ready to work with ketamine, but they've got maybe a clinical supervisor who doesn't understand what's happening there. They'll utilize their supervisor for their regular clinical work, and then they'll establish some time with me, and then I will be able to offer that supervision for their ketamine work. So I like that over actually having to hire people, but I will do supervision and collaboration and partnerships.
Yeah, super cool. Amber, this has been a phenomenal conversation. Thank you so much for shedding some light on just this type of therapy, ketamine-assisted therapy, and your process and your style. This has been really insightful for me, and it makes me really more curious to go learn more and maybe in the future be trained and do it myself out here in North Carolina. So that'd be pretty cool.
Yes.
Amber, if somebody wants to partner with you and do some work with you, how can they reach out?
Yeah, my website's probably the best way to access all my information. That's just Amber Kerby, KERBY.com. And then social media, I always love getting little things out there. It's kind of a fun platform to share information and offer services. So you can find me on Instagram and Facebook at nonordinary.therapy.
Love that. Non-ordinary. That's great. Amber, this has been a real pleasure. I appreciate your time. Thank you for coming on, and maybe we can do it again in the future. How does that sound?
Oh, I hope so. Yes, especially after you finish the certification program and start offering services out there.
Yeah, and then go to your retreat and experience it myself.
Yes.
And that'd be super. Yeah, that'd be great. Amber, thanks again. I appreciate it. Thank you everybody for signing in and checking out this conversation. And until the next one, signing out. Bye.